Here are some of the topics we'll be talking about under the primary hepatic gingival stomatitis today. The primary hepatic gingival stomatitis is a contagious and viral infection that is caused by the herpes simplex virus type 1. It is spread through saliva of the infected person or by direct contact with the lesion. Most common in young children age 6 months to 6 years of age, and it can also occur in adults, especially those that are HIV positive and immunosuppressant. Studies have shown that the most common time to develop this disease is between the ages of 2 and 3 years of age. It is also responsible for the formation of cold sores or fever blisters and can be found on the buccal mucosa and lips of an infected person. It is characterized by high grade fever, painful oral lesions, anorexia, and irritability. Some of the signs and symptoms are malaise, pain around the gum, blisters that can be found on the gum, lips, tongue, cheek, and roof of the mouth, as well as ulcers, drooling in children, bad breath, cervical or submandibular lymphadenopathy have been reported as some of the signs and symptoms. And more on signs and symptoms, we have hyperemia of the oral cavity. There may be some ulceration and even ruptured of these vesicles. These ulcers are quick to bleed and usually heals within 2 to 3 weeks without scarring. Clinically, they are flat, yellow in color, and their sizes are between 2 to 5 centimeters. Once infected with this herpes simplex virus, the infection can reoccur in one third of the patients. And when they do, they are called the herpes labialis, which is also known as the cold sores. It is an intermediate reactivation occurring throughout life. Some of the symptoms of herpes labialis include burning and itching, that is followed by the formation of vesicle lesions in localized area. Some of the contributing factors to these reoccurrence are stress, sunlight exposure, systemic illnesses, and trauma. The herpes simplex virus type 1 is the primary cause of the primary hepatic gingival stomatitis. Apart from that, it's also being caused by the Coxsackie virus infection and poor brushing habits. It has been stated by 90% of the cases of the primary hepatic gingival stomatitis in children occurred as a result of the HSV1, and it has no predilection for gender, color, or geographical distribution. Histologically, the primary hepatic gingival stomatitis appears as a bolus or a vesicle of a small filled lesion within the epithelium and small layers of parakeratosis left on the top. Microscopically, there are some atypical cells which have a characteristic appearance when they are infected with the herpes. Thus, there is a degeneration of the stratified squamous epithelial cells and the formation of inflammatory infiltrates in the capillaries of the dermis. It is characterized by painful erythemaceous and swollen gingiva, multiple tiny vesicles which are present first on the perioral skin, verminal border, and the oral mucosa. Diagnosis is usually clinically diagnosed. Sometimes the differential diagnosis can be used to differentiate it from other disease, and additionally, biopsy and serological tests of live viruses at the vesicle stage can also be used for. The treatment and management include berry lips clean like the petroleum jelly, taking off over-the-counter pain medication like acetaminophen, reason with a half teaspoon of salt and 1 cup of warm water solution. Eating black food like applesauce, mashed potato, bananas, and warm oatmeal can make eating less painful. Drinking a lot of fluid for hydration because we don't want the kids to be dehydrated. And you never ever want to prescribe aspirin. Viscous lidocaine is okay to use but can be contradicting for children as well as they can swallow it. The main medication to be used is the antiviral acyclovir, which can be in form of cream or oral suspension. Dental application is the primary hepatic gingival stomatitis can be spread from the patient to the dental hygienist. As such, the dental hygienist have the responsibility to ensure that they evaluate their patient and perform risk assessment as well as infection control in the healthcare setting. Patients present with the primary hepatic gingival stomatitis should be referred to their primary care physicians and dental care should be placed on hold. Caution patients about auto-inoculation and spreading it to other people, especially to themselves, by placing their hand in their mouth to their eyes or fingers, which can spread to other parts of their body. Never, again, never prescribe aspirin, but the use of NSAID and oral rinse can help to reduce pain. About the fact that the primary hepatic gingival stomatitis is also a potential infectious material that can be found in the oral cavity, and it has a predilection for oral cavity for the most part. Reoccurrences are common in and around the oral cavity. There are lesions that proceed through several stages from the healing before they get to the healing stage. And these stages are the pre-drum, macro, papular, vesicle, ulcer, scab, healed area with redness, and complete healing. These lesions are infectious during the vesicle and ulcer stage, and measures should be implemented to prevent the spread of this infection. Antiviral agent like the acyclovir can block the HSV1 if prescribed early, um, but in the course of infection and at the appropriate dose. The dental treatment should be suspended until the lesions are no longer at the contagious stage. Patients should be referred to their primary care physician when lesions indicating primary hepatic gingival stomatitis. Much, Dr. Chen. Thanks everyone for listening, and I hope you learned one or two things just as I did, and I hope you enjoyed it just as I did enjoying making this. Thank you.